Welcome to Medicine Handy Point. Today, our topic of discussion is history taking in case of abdominal pain. So, let's start the topic. Now, when we start the history, we ask about the biodata, which is the name, we ask about the age, we ask about the occupation, we ask about the education, whether the patient is employed or unemployed, we ask about when the patient was admitted in hospital or whether the patient was admitted through emergency or through the OPD or clinic. So that will cover all biodata. Now the next thing is to ask about the chief complaint. So the chief complaint here is the abdominal pain. So in abdominal pain, we have to ask about the onset, whether the onset was acute or progressive slow onset. Then next step is ask the patient to show you the location where is the pain, where it is generalized throughout the abdomen or any particular area of the abdomen. So location is very important. Then ask about the severity. The severity is mild, moderate, and severe. Mild when the pain is there, but when patient is start to work, he or she forgets the pain. Moderate when the pain is there, and even if the patient is working, he or she will feel the pain. And severe when the patient cannot work because of the pain. So ask about that. Then ask about the nature of the pain. What is the nature? Where it is the burning? Is it spasmodic, sharp? So we need to ask about that. Then in abdominal pain, it is very important to ask about the radiation. Two things: radiation to the back and radiation to the shoulder is very important in case of abdominal pain. Then ask about the relieving factors, ask about whether the change of position or any medication relieves the pain, and then ask about the aggravating factor, especially food intake is very important in the abdominal pain. So ask whether food intake aggravate the pain or no, or change of position aggravate the pain or no, like lying position in case of acute pancreatitis aggravates the pain, while sitting up and leaning forward relieves the pain. Then ask about the association with the abdominal pain, like nausea, vomiting, anorexia, fever. These should be the association which should be asked in the abdominal pain. Now, the next thing is to now in the history dug in deep and ask about the etiology. So we start with systemically from the top to bottom, relating to the structure which are present from the top to bottom, and you must have some questions regarding each disease which can cause abdominal pain, like upper GI problems, esophagus can have a GERD is a common condition. So ask about whether patient having reflux of acid into the mouth, especially of food intake, or especially after bending forward, the patient is feeling any burning sensation in upper part of the abdomen. Ask about stomach problem, especially gastritis, peptic ulcer disease. So ask about any pain medication use. About ask about previous H. pylori infections, liver problems. So ask about hepatitis, ask about jaundice, upper abdominal pain, ask about change in color of urine, change in stool color, ask about radiation of the pain to the shoulder, which may suggest acute cholecystitis, gallstones, ask about pancreatitis, ask about the central abdominal pain radiating to the back in case of pancreatitis, about the kidneys, ureter, and bladder, especially as about flank pain, radiation to the groin, or suprapubic pain associated with increased frequency of urination and dysuria, any pus discharge from urethra, or any blood in the urine. So these will be the question regarding that. Small bowel problems, diarrhea can cause spasmodic abdominal pain, dysentery will cause pain with blood, inflammatory bowel disease will cause abdominal pain, fever, diarrhea, blood in the stool, large bowel problem, constipation, especially in the elderly, will lead to diverticulitis, pain, and blood in the stool, especially in the elderly. If they have any heart problem, ask about that, because ischemic colitis will also lead to abdominal pain, ischemic colitis, and then there is gut, small bowel gut ischemia as well, which also causes pain. So especially ask about heart condition, um, any rhythm problems, any congenital heart problems leading to thrombi to the arteries of the gut, leading to ischemic colitis and acute mesenteric ischemia. Then also about the females problems like ovarian cysts can cause abdominal pain, infection in the endometrium can cause, and pelvic inflammatory disease can cause abdominal pain in lower part of the abdomen with vaginal discharge. So also about those stuff, the things which are usually missed, so they need to be not ignored. These are low lobe pneumonia, also about fever, cough, chest pain, and pain in the abdomen can be because of the pneumonia. So also about that. Also about hepatosplenomegaly. In a history, you can say that, do you feel any dragging sensation in the left or right hypochondrium, which may suggest hepatosplenomegaly, likely because of the lymphoma, leukemia, other malignancies as well. So as about the Addison disease can present with abdominal pain, vomiting, skin discoloration, low BP. Intermittent porphyria can present with abdominal pain, numbness in the hands and feet, and so also about the decay can present with the abdominal pain. So I also about hyperglycemia. Shingles can present with abdominal pain. So also about enuration on abdomen. In the last gut ischemia we discussed in the previous video. I hope you like the video, and thank you, and please subscribe to the channel.